One of the real challenges in South Carolina is that we have just a broad mix of social, economic, environmental, and healthcare factors that are affecting people in communities across the state. Unfortunately, those social factors and economic and environmental factors tend to affect some people in some communities more than others, especially those who live in rural areas, communities of color, those who have disabilities and other factors that cause them to be disadvantaged. And unfortunately, those who have more of those profound social determinants tend to have poor health status and poor health outcomes.
Social determinants of health are very widespread. They can mean anything from making sure that a person has a proper education, to making sure that they have access to health care services, making sure they can become employed because there are employment opportunities in their environment, making sure that economies of scale are taken advantage of. And social determinants of health truly play a part in a person's health. If a child goes to school and the school is focused on making sure that child receives a good education, but they go to school, they're hungry, maybe they have an earache, maybe they have an abscessed tooth, that child cannot learn in that environment, in that classroom, because they're too busy in pain thinking about their pain. And so when we're trying to take care of the whole person, we have to look at all of those social determinants of health. And telehealth is a way to break down some of those barriers.
In terms of our social determinants of health approach, really access to care is our main focus, because some of these families live 30, 45 minutes away from any healthcare organization. They may live near a Walmart, they may live near a CVS. They have minute clinics and they have, quick fixes, and those are good. Those are very helpful. But in terms of pediatricians, in terms of your specialty care, what if a child has diabetes? What if a child has asthma? What if a child needs mental behavior care? Those type of facilities are 30, 45 minutes away for a lot of these families. What our telehealth program can do is connect people to the correct resources that they need.
Those communities, especially rural communities and other underserved communities where the health is not as good because they don't have the range of resources, including access to health care, that not only affects the health of those communities, but it negatively impacts the health of the overall state. And so from an economic standpoint, that's not a good situation for the business community. It actually contributes to increased healthcare costs. So if we can find more effective ways to provide health and social services to those individuals living in those underserved areas now, not only will it help improve their health and well-being, but also will end up helping to improve the overall health and economic well-being of our state.